Good afternoon, and thank you for watching us and for participating in this panel with us. I want to thank the FIS Initiative for the opportunity to be here. And I also want to thank everybody from our audience. Thank you for waiting. We're still trying to solve some technical glitches to bring Daniela Komatsu on board with us. We'll be starting now. And in the meantime, while we'll wait for Daniela, I'd like to introduce to you Wagner Amaral, who developed his career in IT companies. He's been at Avanade for over 10 years. He's a senior executive in charge of delivery and with a focus on life sciences and healthcare. And he has the challenge of helping clients through digital transformation using the Microsoft platform and developing the new generation of services in this industry. I'm Rogerio Boros, an electronic engineer, and I've been in the technology industry for over 25 years. And I'm also a leader at Microsoft. And very soon, Daniela is going to join us. She's been working in the IT sector for over 20 years. She developed most of her career in major international companies, and currently she is the senior IT manager for the Fleury Group. She's been working on the digital, or on giving support to the digital evolution of the patient's journey. So to start with Microsoft, our mission is to empower each individual and business on the planet to achieve more. And in the healthcare industry, our mission is to empower our customers and partners to deliver more personalized and accessible healthcare. In that model, we decided to have this conversation, taking this opportunity with Fleury and Avanade about the possibility of having a digital journey for our patients. So we know that there are several interesting digital hotspots from preventative care, the medical visits, diagnosis, and the post-treatment care. If we look at the entire journey, there are several points where things are becoming more and more digital, and that's a demand from this new generation, and also in a post-COVID scenario. If we start identifying some hotspots along that journey, we'll see the possibility of getting information or making appointments through a chatbot or a telemedicine services, automatic check-in, authenticating your healthcare insurance plan credentials. Or if you're talking about the public health system, you can also authenticate the individuals' documents, approval of procedures and medical visits. I mean, how you can access the medical records, treatment plans, and also with an integration with pharmacies. Once you get the prescription, remotely monitoring the patient's health, reimbursement for medical expenses. So, I mean, there are several digital hotspots to manage the patient well-being. And according to that perspective that we've been working on, we have processes that will integrate several different departments, not only in terms of the patient's experience, but also in terms of the experience of the medical team, and also guaranteeing data privacy, security, integration. So with that, I would like to ask Wagner our one first question, and I'll ask you to please share with us your opinion about what is the role of a digital robust platform in delivering services to patients along their journey. Well, thank you for the invitation, and thank you for inviting me to discuss such an important subject, the digital journey of patients. The healthcare industry is certainly undergoing a huge transformation. COVID accelerated a pre-existing transformation and also increased the amount of investments being made in this sector. From a perspective of a digital journey where we think about patients and each and every point of a touch point with a healthcare provider, from making appointments and post-care, pre-care scenario, for you to get a full perspective about the patient's life and the relationship with that company or that entity, whether it's public or private. Having a robust digital platform is extremely important, as the case of Microsoft's platform, in that it allows you not only to deliver a differentiated experience to your patient, but also as digital transformations occur, as technology evolves, the platform starts adding new features, and you can very quickly make them available to your customers. And that's point number one, when it comes to having an updated platform, one that is constantly alive and that's constantly adding new features. There's another very relevant aspect, which is the open platform that allows for data interoperability, which is extremely relevant in the healthcare department, allowing you to connect systems, allowing you to connect with the medical records and other internal systems, and you can consolidate data intelligently and quickly to improve patient care. And lastly, I would say that having a robust platform to connect with patients allows you to have insights, which is extremely relevant for the patient health. And through data analytics, you're able to have insights to improve patient care. So having a platform that allows for constant evolution and that is aligned with the technology trends is extremely relevant to make this become a reality. The having a digital patient journey that's increasingly agile, flexible, and that provides a better experience. That was a great answer, Wagner. And if we talk about the perspective of Avanade's experience, and apparently Daniela is having difficulties connecting, we would like to hear her perspective about how this transformation process is happening at the Fleury Group. Let's hope for the best. And maybe by the end of the panel, she'll be able to join us. If not, maybe next time, we'll be able to talk to her. So I'd like to ask you, what does Avanade consider to be most relevant in designing a patient's journey? Sometimes we might consider that the journey is all about the user's experience, but I believe there are several other aspects. From your perspective, which aspects do you consider to be most relevant? Well, the most important thing about designing a patient journey is to design along with your customers, with your clients, define the points of interaction that patients could have with that company, that healthcare provider, and also to define how to create a journey that's as fluid, as seamless as possible, so that there is no difficulties preventing patients to have a good relationship, a good communication, and so they can have access to data from that company. At Avanade, we've been working from the very beginning in designing this digital experience, and from the designing the concept and the digital product that the company wants to create. So the entire design of the journey, from its concepts to the steps that are required to implement them, and to the point of implementation, maintenance, and evolution of that platform and that journey as a whole. So to us, we focus on the patient's needs and the need for them to have access to their data and a seamless interaction. That's the starting point. And after that, we start then developing other projects and programs that will add to the platform to leverage that journey. Well, Wagner, there's one thing that we usually discuss, and that was actually part of our panel yesterday, which is that in this experience, in this migration towards patient's digital journey, there are some factors that go beyond the user interface and all of that, but factors related to security and privacy. What could you add in that regard in terms of when you're designing the patient's digital journey and every party involved in that process? What can you tell us about that? Well, we know that security is key when it comes to digital journey. We talk about processes going digital. I mean, security comes first. And in that regard, I think that throughout the entire project, from the moment we start designing it, we have to have a security mindset and keeping in mind how to maintain data secured throughout the journey. If you do data analytics, how to anonymize data, for instance, how you can make sure that the data remains relevant for the organization, but at the same time that they're secure and they can only be accessed if that specific patient allows their data to be accessed. So I think the main aspect related to this is that the patient needs to be in control of what they will allow people to access in terms of their data and in terms of who can access their data. So security is fundamental. And Microsoft's platform, a robust platform that we deployed at Fleury, for instance, it has a high level of embedded security. It's actually its priority number one. Okay. So picking up on what you said, you mentioned the example of a Fleury group. From your perspective, how can Avanade help customers implement a patient journey? And maybe you could also talk about the main challenges and aspects, hurdles that you found in your journey with Fleury. And if we may, since Daniela is not here, she would be representing the Fleury group, but she was unable to connect this far. Well, Avanade has a large experience in the healthcare industry. So we ally our technical knowledge, our knowledge about the industry to the Microsoft technology that we use for a platform with the experience of developing these transformational experiences to our customers to develop these journeys. The main challenge at Fleury and also with other customers is to be able to identify which are the main points of connection and how you can integrate the internal systems and the pre-existing data of organizations, which are large companies that have data collected over the course of years of existence. So how can you integrate all of that and connect all of that into a digital new world? So our main challenge is to integrate the existing data and bring them to life on a new platform. And the second challenge is to make sure that patients will have the best possible experience, thinking about a multi-channel experience, whether it is through the portal or over the phone or through the chatbot or a connection through WhatsApp or Telegram, through text messaging apps. So the biggest challenge is to make sure that the entire chain will be integrated, not only in terms of the patient's experience in connecting with the company, but also in terms of how you can connect data internally and make the necessary connections with the pre-existing systems of the company that make the company work and continue to deliver high quality services that it usually does. So these are the main challenges, I would say, for this integration to occur seamlessly and effectively. Well, if you allow me, um, I was going to mention something which to me is also a big hurdle in this digital journey. Obviously, to identify everything that exists in a process from an operational standpoint. If you take the example of a hospital group or a group of labs, and identifying all of the stakeholders involved, the journey, the service provider, the authentication with external groups, and obviously with the concern of avoiding errors. But there's one interesting aspect in this industry, which is the interoperability across data platforms, and to define if you can exchange data securely among the parties involved. And one thing that's accelerating this process is the adoption of the FIRE protocol, which is allowing us, and that's something that we're seeing grow across the healthcare industry. It allows us to provide the secure data interoperability. If we look at the digital journey of our patients, and I see there are several different things we can do in terms of integration between different healthcare service providers, and in terms of the opportunity of providing interactions in the patient journey. Of course, if you move away from this end, which is the healthcare provider that will provide initial care, and move to the laboratories, and then move to a surgical treatment or any other treatment that might be required, such as exams and medical treatment and the drugs that will be used. The biggest challenge is that you're not always going to find groups that will be operating across all of those segments. Additionally, in Brazil, there's an interesting feature. If we look at the Brazilian population, and that's data from IDC from last year, so it's not that old. 80% of the Brazilian population is almost exclusively served by the Brazilian public health system. And there's another part that only uses private healthcare, and the rest of the population uses supplemental healthcare insurance plans. And obviously, there are many people that use both the public and private sector. So, in this scenario of patient digital experience, maybe it would be interesting looking into how I can make better use of the national policy of IT and healthcare integration to deliver an integrated experience to patients in the private setting, maybe using some aspects that exist in the public setting. Maybe he sees a doctor in a public hospital, but will then have his exams in a private lab. So there are many sweet spots where we can discuss this integration regarding the patient's digital journey. So, from your perspective, what other things would you say, Wagner, that are interesting for us to take into account in terms of providers, and more often than not, when it comes to the patient's digital experience? So we also have the collaborators' digital experience, the shift changes and connections between sectors of finances, legal, and whatnot. So, what other things would you recommend, and what other things would you identify in this analysis of digital experience in health?
And then when we talk about digital experience as a whole, encompassing not just the patient, but the whole chain and all caretakers, the entire care journey, nurses and all health-related processes, and the entire back office of healthcare organizations, and all the employees and healthcare workers that you put in the equation. But when we think of the digital experience is going to be deeper and more effective as the entire company goes through transformation. So it's very relevant for professionals and employees to be also prepared to meet the needs of the customers, the internal customers, patients, or other service providers or healthcare workers, as they also have a digital platform to work with. So, the digitalization of internal processes and you helping them to have a differentiated work experience that is also digital is fundamental for you to fully execute the digital experience. So we talked about digital transformation. Digital transformation is not just about technology. It's an enabler. It's related to the company's culture. Many times it's not effective because there are many silos in the company that are communication bottlenecks and difficulties that are part of the processes of the company. So a healthcare company thinking in a broader way in terms of digital transformation, they need to think of a vision in terms of communication with patients, providers, care providers, healthcare workers, as well as with internal staff. You need to deliver a digital experience with the many nuances, many locations, and many points of contact with people. So this is in terms of transformation. You need to have a 360 vision from within to without and from inside out. So this is effectively going to enable the company to provide a differentiated experience to customers. Well, I looked here and I didn't see any questions from the audience. And I would like to thank once again for the opportunity of us being here and talking today, complimenting and apologizing. I think that we have problems for Daniela Komatsu to join us. And Daniel was going to tell us a little bit about the transformation process that Grupo Fleury has been going through in terms of the patient journey and how the use and adoption of a CRM platform met the expectations of Grupo Fleury and the main challenges that they were faced with in implementation. This agrees very much with what you said, Wagner, which is the process, culture, how you train people, because there will be a change and everything that they were doing, and which are the main benefits that they obtained with the adoption. She was going to cover all these points. We hope that maybe in the future we may have a new discussion with the participation of Grupo Fleury, Danny, and others, for them to share their experience with us. I would like to thank very much the points you've mentioned, Wagner, with regards to the planning and delivery of this type of solution. And once again, I would like to thank FIS Initiative for the opportunity, and we are now closing our panel. So thank you very much once again for participating. Thank you.